Hello everyone, my name is Smith and I'm going to be presenting my PowerPoint about diabetes type 2. What is type 2 diabetes? Basically, the cause of this disease begins when your cells become resistant to the active insulin and the pancreas can't make enough insulin. These are a couple of causes of diabetes: a genetic problem, weight, bad food choices, stress, lack of vitamin D, nutritional deficiencies. Next is the affected cells by diabetes. We have nerve cells, peripheral nervous system, gland cells, and immune system cells. First, to begin with, which is the nerve cells, neuropathy can be a result and is caused by an excessive amount of sugar in the bloodstream. And around 60 to 70% of people with diabetes will form this type of neuropathy. Next, we have peripheral nervous system. It's made up of all the nerves outside of the brain and spinal cord. Also, the automatic or involuntary process like the heart rate and digestion. The peripheral nerves begin with tingling and numbness in the hands or feet. We have the gland cells, which is affected and it keeps constant glucose, and it keeps the sugar levels in the body constant. We have immune, which is affected and destroyed. The disease makes the system destroy insulin producing cells within the pancreas. Next, diabetic individuals. Immune system is very much low and they are susceptible to getting infections. Lastly, we have muscle cells. They're affected due to the nerves being affected, and that's when muscle weakness falls into place. Next, we have the affected organs by diabetes. Kidneys can be affected, eyes can be affected, and the heart can be affected. Affected organs, first to begin with, is the kidneys. Studies show that excessive sugar levels in the blood affect the glomerulus, or the blood filtering units of the kidneys. There's 5 stages for the kidney process. The 5th stage can result in having dialysis or a kidney transplant. If hypertensive is to occur, stress can be bad for the kidneys. Next, we have the eyes, which are affected. With diabetes, 2 issues can occur. Cataracts can form and they can change the fluid pressure in the eye, and damage to the optic nerve, which causes glaucoma. Capillaries are clogged. Weak capillaries will grow in an improper place and impair the vision. Next, we have the heart, which is affected. It leads to thickening of blood vessels that supply blood to the vital organs of the body. Diabetics are more capable of getting high blood pressure and high cholesterol. Next, I have the affected tissues by diabetes. We have the nerve tissues, the connective tissues, and we have the muscular tissues. The nerve tissues is affected by diabetes, the same as the nerve cell. It causes neuropathy in the hands and feet, and they can get numb, which limits driving a motor vehicle, and the tingling also occurs in the hands and feet, but most common in the feet. Next, we have the connective tissue, which is structural support and energy storage. Diabetes will decrease the patient's energy, and there won't be an increased amount for energy storage. Secondly, due to the muscle weakness and nerve damage, there won't be much of a structural support. The cartilage and bone will be very fragile. Next, we have the muscular tissue, which is affected in a way where the diabetic individual, they aren't capable of a normal function in their daily routine. And also, their body can be weak and they won't have much strength to produce movement. Next, I have the affected functions of the body. First I have on here, there's the heart and blood vessels, which will increase the risk of various cardio problems. We have heart attack, stroke, and we have high blood pressure. Next, we have neuropathy, which is nerve damage. Next, we have the excessive amount of sugar, which can injure the walls of the tiny blood vessels. There's numbness, there's burning, and there's pain. Next, we have another damaging to the nerves, which causes nausea, vomiting, diarrhea, and constipation. Next, there is kidney damage, which means diabetes can damage this filter system. Severe damage leads to kidney failure and or irreversible end-stage kidney disease. The eyes are affected and a person can potentially become blind. How to care for your diabetes type 2. We have nutrition therapy, we have physical activity, there's other lifestyle measures, which is medication, and we have where the patient can see a specialist to treat the complications, and we have bariatric surgery. Diabetes care, first to begin with, is nutrition. If you have diabetes, you should have an individualized meal plan that not only helps to manage blood sugar levels, but also helps to manage blood cholesterol and blood pressure and any other medical conditions. Diabetes can work with a registered dietitian or diabetes educator to design a diabetes meal plan. Next, we have physical activity. Get your physician's approval first before beginning or participating in any sort of physical activity. According to ADA, they recommend that 150 minutes per week of moderate intensity aerobic activity, such as brisk walk, can be helpful, or resistance training at least twice a week. And limit your exercise if there are other major issues with the body. Next, we have medications. Many people with type 2 diabetes start with the oral drug metformin to help control blood sugar levels, and then add other drugs to their regimen, either soon after diagnosis or months or years later. There's 10 sorts of drugs which will decrease the sugar levels. Many people with type 2 diabetes eventually need to use insulin. Some will need to take 1 or 2 doses of long-acting insulin per day, and others will need to take long-acting insulin with rapid-acting insulin before meals. This is a list of the specialists which can help diabetes cope with their issues. We have cardiologists, we have a dermatologist, we have the eye doctor, we have the kidney specialist, we have the neurologist, and we have the urologist. Lastly is the bariatric surgery, also known as weight loss surgery. This surgery restricts the amount of food that can be eaten and or changes the way in which nutrients are absorbed in the digestive tract. Bariatric surgery has been found to effectively reverse their diabetes. Blood sugar levels become normal, and they don't need to take drugs to lower their blood sugar levels. Thank you very much. That is my presentation, and these are my references for the presentation. Thank you.